Are you struggling with chronic sacroiliac joint pain or SI joint pain? In this video, I'll talk about some of the reasons I think SI joint pain is happening and some solutions that I've used that have helped my patients with SI joint pain to help get you on your way. What is the SI joint? Well, we have a sacrum in our pelvis, which is an extension of our spine. And then we have an ilium. This is the S of the SI joint, and this is the I of the SI joint. And here's the SI joint that's formed between the sacrum and the ilium. Now, if your pain has happened as a result of pregnancy, it's important to understand that not all pelvises are built the same and look the same. So if you look at this image here, you'll see that there's a wide variety of shapes of pelvic bones. Typically, female pelvic bones are wider and broader, and male pelvic bones are taller. During pregnancy, what happens is that the ilium of the pelvis actually opens and closes to create this birth canal through which the baby passes. Sometimes this can be asymmetrical, possibly based on problems you're having prior to pregnancy, such as tight or weak muscles, asymmetries in your legs, and so forth, so that one side of the ilium will open and close more than the other, creating this asymmetry. This can create torque across the SI joint. So there are many things that you can do if you had, lower body pain, hip pain, pelvic pain, or back pain prior to your pregnancy, and then after pregnancy you developed SI joint pain. It's likely that solving those prior problems to pregnancy will also solve the SI joint pain as well, because those problems may have created the asymmetry of the opening and closing of the ilia during the birthing process. We'll cover some of those things in this video. I'd like you to please subscribe, like, and share this video if you find this information helpful. That would help me a lot. Thank you. All right, so let's get into some of the things that might be delivering force to the SI joint. All right, so it's important to understand that the ilia can be tilted forward or back, and as I just mentioned earlier, that it can flare out and then close again during the birthing process. So what I'm going to be focusing on primarily is the forward tilting and back of the pelvis, because those are things that can be changed through addressing problems in the lower body. So in order to understand what may be working on your pelvis and SI joint, I'm going to ask you to do two simple tests. The first one is I'd like you to lie on the ground with your legs straight and sense if you have back or pelvic or SI joint pain with this. And we're going to stay here for about 30 seconds. And then what I'm going to ask you to do is bend your knees so your feet are flat on the ground and see if that alleviates your SI joint pain or reduces it in some way, or your back pain or your sciatic pain. All right, so we've done that first test, and what that's determining is if your SI joint pain or back pain or sciatic pain has changed when you bent your knees, which in most cases it will alleviate a lot of that pain, then that's telling us that you have what's called an extension problem, which essentially means that you have too much arch in your spine, which is called lordosis, or you have too many forces trying to pull your spine into that arch. And that pattern of problems is also feeding the SI joint. All right, what this is also telling you is that because this pain has changed with the position of your legs, that your legs have a lot to do with what's happening here at that SI joint pain. And we'll get into that in just a second. Now, the second test I'm going to ask you to do is simply have someone take a picture of your back, like these images here. And you'll see, if you look closely at these images, that there's a larger crease on one side of the spine than the other. So what this is telling you is that one side of your pelvis is higher than the other. And typically, what's happening is that one side of the rib cage is lower than the other. This is called a side bending problem. And this is often misdiagnosed as a leg length discrepancy issue. So if a practitioner sees one side of the pelvis that's higher, what they'll do is ask you to put a heel lift under the other leg to balance out the pelvis. But that's not really solving the problem because you don't truly have a leg length discrepancy in almost all cases of this. What has actually happened is that you've developed a compensation pattern for problems in either the same leg or the opposite leg. And usually these are due to older forgotten injuries that haven't been rehabbed correctly. In my book, Pain Patterns, I go over tests to determine where these problems are and what they are in your body that are feeding up the chain to the SI joint, the sciatic nerve, and low back issues. So I strongly recommend that if this information sounds right to you, I have a link to my book below in the description. Please just purchase that book and you'll have all the tests and exercises to correct these problems. In my book, I also have videos. Well, they're not in the book, but if you go to my website, you can access videos to all of the tests and exercises too to help you really hone in on doing everything correctly. All right, so let's get back to what we've just learned. If you found that your SI joint or back or sciatic pain has changed with your knees bent, then you have an extension problem, which means that you have too much arch in your back. And then we've also determined that if you have a crease on one side of your waist, that you have also a side bending. So you can imagine that if your spine and pelvis are side bent and arched, it delivers significant torque through that SI joint pain. And luckily, we can change all of this. So I found one of the simplest and most effective ways of changing this is by stretching the thigh muscles in front of the legs. The reason that this helps a lot with SI joint pain, sciatic pain, or back pain is because the thigh muscles attach to the front of the pelvis here. And so they deliver a force by causing the pelvic bone to tilt forward. Well, sometimes this force is symmetrical, and sometimes this is asymmetrical. If this force is asymmetrical, then it's delivering it's setting up a rotational torque that's occurring through the pelvic bones. And especially if this was the case, if this was happening prior to the pregnancy, what you've done is you've added that load from carrying the baby and the excessive extension that's happened to your back as a consequence of the fetus developing. And that has been compounded by the fact that you have an asymmetrical force acting on your pelvis. This has likely set up the conditions where your pelvis is now asymmetrical and kind of stuck there because during pregnancy, all of these ligaments loosen in the pelvic structures. But if the muscles haven't been addressed that were a problem prior to that, then they've loosened and then firmed back up in the same pattern that you had prior to the pregnancy, and because everything is loosened, it may have exacerbated the asymmetries that were acting through your pelvis. I hope that makes sense. And this goes for guys too. Of course, guys haven't given birth to babies, but the same asymmetrical forces act on men's pelvises as act on women's pelvises. But it becomes worsened if women have had children that then result in SI joint pain. And then that SI joint pain can happen immediately after the pregnancy, or it can take months or even years to develop because all of these conditions have been set up to fail and then compounded by walking patterns and so forth. Again, a lot of these things are explained in my new book, Pain Patterns. So please get a copy there if you want to dig down deeply into what these problems are that you can fix. All right, so how do I stretch the thigh muscles to solve this? Well, we kind of do it like this. I ask you to lie down on a firm surface. A firm surface is better because it's giving more feedback into your pelvic and spinal structures and will help stabilize those better. And then you simply hold on to both knees and you lower one leg down, making sure that your back doesn't arch as a result. So you're going to pull back on that opposite knee to make sure your back stays nice and secure. And so you'll lower that one leg down, and then you'll bring that leg up, and then you'll lower the other one down. And you're going to see whether one side seems to be tighter than the other. Usually this is what's happening with unilateral pain in the pelvis or sciatic pain or back pain is that one side of the thigh muscles becomes tighter than the other, which is delivering this rotational torque that I was just talking about. So how would you correct this? Well, you just do the same test. The same thing that you did to test it, you would do to correct it. You would just let the leg dangle and let those muscles lengthen. And you should notice an almost immediate reduction in SI joint pain or sciatic pain or unilateral back pain as a result of this. Now, some people need a chair underneath the foot because their legs are too heavy and it's delivering too much force to the pelvis, and it becomes painful because of that. Well, so you use a chair and you lower your foot down to the chair, and then you just simply lower the heels down while your toes are on the chair to help control the weight of your leg and take that off those pelvic structures for you. I hope that helps. So there are also walking pattern problems that are happening here, and there could be things happening in the foot or the ankle. I won't go into that into this video because it would become a very long video. But this should help get you started to understand what's working on your pelvis. So please do those two tests, the extension test I offered at the beginning, the side bending picture of your spine to see whether you have a crease. And if you do, then you likely have an asymmetrical torque acting through your body. The thigh muscles are one of the reasons that might be happening. So try that thigh bone stretch to help you out. Again, if this video has helped you understand what's going on with your pelvis and back or SI joint pain, please subscribe, like, and share. I try to create new videos every week to help people with their pain. Also, if you want to dive deeper into what's going on, how all of these things are created, why they're created, and how to solve them, please get my new book, Pain Patterns. Thank you.